Awesome. So we will kick it off then. As I said, others will be joining. Looks like we've got a pretty good crowd already. So that is great to see, and hoping that others, will be joining us here shortly. But this is our webinar, and we are hosting it in conjunction with the NAFC. We are lucky enough to have Ariana from the NAFC on this call with us. A lot of those who are joining to listen to this are probably familiar with Ariana to some extent. She works very closely with CareMessage and a lot of the free clinics that we talk to. And we're also very lucky to have Peggy from Mercy Clinic, the executive director of Mercy Clinic, on this call. And she's been a great partner of ours. Mercy Clinic has actually been a CareMessage user since about 2014. So they date back way back with CareMessage, considering we actually started as a company in 2012, and we have worked with them pretty much this whole time moving forward. So what we are going to do is just do a quick little opening welcome. Then we're going to talk a little bit about CareMessage here. Going to talk about our solutions overview, a little more about the CareMessage platform, CM Lite, which is our free version of our platform, and then some of the great use cases that we've seen around COVID so far from some of our member clinics. We will then pass it off to Peggy to talk about Mercy Clinic and their experience with CareMessage, primarily for this last year surrounding COVID, of course, but also, some of the previous years as well, having been a partner of ours for the last 7 years, as I mentioned. And then we will end this call with a question and answer section that we have dedicated specifically. So if there's any questions in the chat, we'll take this opportunity to answer all of those. And once again, it'll be a pretty free-flowing call. So if there's any questions along the way, we might just take the opportunity to answer that at the time that they're being asked as well. So what I'd like to do first is pass it over to Ariana, if she's on the call and able to speak for just a couple of minutes here about the NAFC and then their partnership with CareMessage. So I'll hand the floor over to you, Ariana.
Great, Jameson, thank you so much. So as you, most of you, I would assume know, because you get so many emails from me, and I have had great relationships and friendships with a lot of you on the line. My name is Ariana Gordillo. I am the Director of Strategic Initiatives at the National Association of Free and Charitable Clinics. And so I'm very excited. I just have a couple words to say. I'm very excited about this presentation with the NAFC's partner CareMessage, featuring one of our own members and your peer, Mercy Clinic. CareMessage has been a partner of the NAFC's for a number of years, supporting our free and charitable clinics and charitable pharmacies across the nation, really toward the ability to grow patient engagement through technology. And as we all know, in the past year and a half, COVID-19 has really put the world on its head. And you all know this more than anyone. But one of the great things that I've seen is that our member organizations have really been able to pivot in 2020 and 2021 in order to continue serving their communities. And so whether that was through telehealth or telemedicine, street medicine, adjustments to their general operations, et cetera, I think free and charitable clinics have truly answered the needs of their communities. And so this is why I kind of think that this presentation is pretty cool. We can see yet another way to engage, in this case regarding vaccinations and such, and also learn a little more about this incredible resource that is already available to your organization. So in any case, I will hand it off to our partner. Jameson, I'll hand it off back to you, but I just wanted to say thank you all for joining us today. This is a wonderful partnership that we've had for a long time. And so we're excited to learn more and see what a great example Mercy Clinic has been. I don't know about you guys, and I know that she'll talk about this in the presentation, but we've just seen some really cool numbers and stats and anecdotes and stuff coming out, and so I'm very excited about this. So again, thank you so much for having me, and I'm excited for this presentation.
Thanks so much for joining us, Ariana, and we're really happy to have you here, as well as Peggy, of course, and the partnerships that we've been able to establish over these last, couple of years, and especially this last, year and a half now with COVID hasn't been easy for anybody, but we're lucky to have partners that are as strong as we do that's been able to, make it just a tiny bit easier over this difficult time. So let us kick it off to meet CareMessage. So I'm sure many on this call are familiar with CareMessage, maybe some not so much. But we'll just give a little overview of what CareMessage is and what we're setting out to do. So CareMessage was founded in 2012, as I mentioned earlier. So we are a patient engagement platform, and what makes us unique is that we are actually built specifically for underserved patient populations and the safety net organizations that serve this patient population. And we currently work with about 350 safety net organizations across the United States. That number is actually outdated with how quickly everything's moving. It seems like on a day by day, hour by hour basis, we are having new partners join our platform. So we're actually closer to a 400 number of safety net organizations. And since March 2020, that is, over 25 million text messages have been sent via our platform around COVID-19. Just a really astounding number. And we've seen tremendous growth, working with so many great partners, free and charitable clinics, FQHCs, community health centers, and the likes. And our platform's really set to be able to, focus on clinical outcomes and research, but exclusively for this underserved patient population that we serve. So we are, what I like to say, one of the greatest crowdsourced platforms out there, because having nearly 400 safety net organizations gives us a great slot of information about what works well with this patient population, what doesn't work so well, and then we can take this information that we gather from great partners of ours like Mercy Clinic, who will be speaking in a few minutes here, and be able to use what they learn about their patient population to in turn better the CareMessage platform. So what is the CareMessage platform? We are a all-inclusive platform. We like to say that we're a platform that is able to help the full cycle of patient engagement, from actually setting a patient up on CareMessage or adding a new patient, to scheduling appointments to see that patient in clinic, being able to follow up with that patient either via a patient satisfaction survey or a post visit just message that's available. We want to be able to send patients messages if they have referrals to an external provider or for specialty care, to understand if they were able to close that loop in care. We really want to be an all-encompassing platform able to help the patient's experience from the first day that they come into your clinic to hopefully their great experience with you for many years to come. And how do we do that? Well, a couple of different ways. One of those is with our 300 plus templates that we have within the platform. This is really a way to just hit the ground running when you get started on CareMessage. We have made it very much that we don't want each individual free clinic and health center having to redefine the wheel and rebuild the wheel. So we, once again, using our crowdsourced platform, are able to share templates from health centers that have worked previously and share those with our other partners, of course. We make a big push to ensure that we're not alienating any of our patient population, whether that be having messages in a multitude of languages, at or below a 6th grade reading level, ensuring that all of our platform is done via SMS rather than having to download any sort of apps or use the internet. We want to make sure that our platform is able to be used by as many as possible, as well as possible. And then, of course, the ability to personalize. So all messages and features on CareMessage are able to be personalized by the health center themselves, with the help of our support team and customer success team, to ensure that use cases and goals are met. So what does that mean in terms of actually driving the meaningful engagement that we want to see? There's, of course, a difference between texting or calling a patient just to text or call a patient, and then doing so in a very meaningful and purposeful way to garner the responses and the results that we want to see. So what we've done is we have clinically proven approaches for behavioral change. We are very mindful about, every single message that's sent through the platform being done so with a purpose and to, incite behavior or get data back that we're looking for specifically. And there's, of course, always the fine line between, communicating with the patient and even potentially under communicating with those patients that have gaps in care or you have not seen in the clinic. And then, of course, over communicating with the patient population, especially in a forum and a means of communication, such as text messaging. Most people in the world now seem to get texts just about everything for, their grocery delivery, their Amazon purchases, their food delivery. Really, everything seems to receive a text now. But of course, there's still the intricacies and the newness around being texted and communicating with your medical providers in your health center directly via text. So we want to be very, we want to make sure that we are very purposeful about what we send and being focused on underserved patient populations, whether that be, unique traits, preferences, literacy barriers, whatever it may be. We want to ensure, once again, that we're not alienating any of the patient population. So one of course, the biggest uses or biggest ways of engagement at this point in time is surrounding the COVID-19 vaccine, as well as COVID testing. Really anything COVID related at this point in time, as you all, I'm sure, know, is the main or some of the main use cases for communicating with patients. And one of the great things that we've done at CareMessage is we have our own COVID-19 vaccine library, which I'm sure Peggy will talk about in just a few minutes here, as they've actually been using this message library over there at Mercy Clinic. But what we did is we made this information public domain. We'll share out the link at the end of this call. But any health center, or really anybody who wants to take advantage of these messages, it's an open sourced library. So we've even seen health centers that take our messaging, but they use it to text via an ECW or some of the other platforms out there. We want to make sure that that's a possibility as well. And we have such a great source of data, once again, having so many safety net providers, that we thought we would be doing really a disservice to all safety net providers out there by keeping this data and the results of the messages that we see get such a good response rate and have so much engagement. It'd be unfair for us to keep that data to just ourselves. So we've made it an open message library. And those messages, are anything from patient safety concerns about the vaccine, patient eligibility to receive the vaccine, patient's interest, vaccine availability. One of our most recent messages is actually about the Johnson and Johnson vaccine. As we all know, a month or so ago, when there were the concerns surrounding the Johnson and Johnson vaccine specifically, we created some message, or we grabbed some messages from some health centers that were doing some really cool things with them, trying to, either host live Facebook lives in order to speak about the Johnson and Johnson vaccine to their patient population, or linking to the CDC for the newest info. Just keeping, the patient's interest in their ability to get the best knowledge and information top of mind. So we have sent over, or I should say, health centers have sent nearly 6 million message about the vaccine specifically through CareMessage. Once again, a pretty astounding number, considering the vaccine's really only been top of mind, as we all know, for this year really is when it's been available. So we have a couple of different examples and use cases of text messages that were sent to patients from different health clinics. One of them being a health center in Texas, where they were actually tasked first with scheduling 900 appointments for the vaccine. The first time they decided to do this, they did so via manual phone calls, where they had 6 different staff members making phone calls over a 4-day span. They estimate that this took about 192 full-time employee hours to complete, most of which was, as you can imagine, leaving voicemails for these patients. And their employee satisfaction was not super high after doing so. I don't think most people's favorite part of the job is leaving voicemails and making phone call after phone call down a list. So what they decided to do for comparative purposes was send the next batch of messages via text in order to schedule their 900 new appointments. They use CareMessage to do this, as you would imagine. And instead of the original 192 hours of calling, it took them 32 hours this time to schedule these 900 appointments. And, about 10 minutes of that was actually sending out the first bulk outreach. And then the rest of that time was using text to actually schedule the appointments, answer any questions that patients had, reschedule appointments, whatever it may be. Meaning that this was a 600% increase in time savings, took about 18% of the time to text that it would have taken them, or it did take them, to call. Secondly, we have a health center in Louisiana that was sending an outreach message to all of their patient population above the age of 70, talking about their eligibility for the vaccine. What this was a just an open-ended text message asking patients if they were interested in receiving the vaccine. If they were, please text us back yes. If you're not, please text us back no at this point in time. And this is one that we especially love to talk about, partially because about 1/3 of the patients responded to this message, which is a really, really good rate of responses, as I'm sure everyone knows on this call. 2/3 of those, so about 66%, responded, yes, they are interested in the vaccine. Meaning, of course, the other third said, no, they are not. But the really cool part with that is that even those that responded, no, they're not interested in receiving the vaccine at this point in time, most of them ended up giving a reason, either, hey, I've already gotten the vaccine, or just not wanting to take the vaccine at this point in time, expanding upon what they wanted to state. And the other cool part of this, the multifaceted, is that this was a patient's, their patient population that was specifically over the age of 70, which is, of course, a question that we get pretty specifically from a lot of our partners is, does this text messaging work as well with, our elderly patients as it may with other parts of our patient population? And what we've actually seen is a resounding yes, it does. Whether that be, the patient themselves texting, or having a family member or a friend help them with texting, whatever it may be, we see that this is extremely effective with older populations as well. And then lastly, we had a health center in Arizona that used CareMessage to text their patients actually a self-scheduling option to schedule online appointments. So what they did was they just sent a link to their online self-scheduler saying, hey, we have COVID vaccine appointments open. Would you be interested in, scheduling these now? And what they were able to do was schedule 700 appointments via this. They never really had to talk to patients at all, except for to answer questions, of course, around the vaccine or whatever the patients came back with. But they estimate that if they would have done this same workflow, but instead making manual phone calls to schedule these 700 appointments, it would have taken them about 116 staff hours longer that they really just did not have the time or the bandwidth to distribute at that point. So some other use cases with CareMessage. Number one is going to be about public health guidance and the ongoing education around the vaccine. So this could be, even something as simple as sharing health center updates, state or local updates, clinic closures, vaccine clinic dates, food drive dates. We have so many different use cases that we have really seen health centers get pretty original and unique with how they actually use CareMessage, even texting their staff members and their volunteers to let them know if there's weather issues and to not come into work, or whatever it may be. So one example that we saw was from a clinic in Florida. In Florida, actually, the governor issued a requirement that any anybody in Florida was required to bring proof of residence, either via a state driver's license or some sort of address utility bill or statement before they were able to receive the COVID-19 vaccine. So what our clinic here in Florida did was they sent this mass outreach to all of their patients, and they heard resounding good news back from the patient population. And unfortunately, on the flip side, they even heard from their patient pop that was able to, of course, come in prepared and they were able to get their vaccine, but they heard numerous examples from others outside of their clinic who did not have this same information, that were actually being turned away on the day of their appointment because they were not bringing this information, and all kinds of horror stories. We also had a clinic in Michigan. I briefly touched on this example, or an example similar, but what they did is they actually hosted a Facebook Live video on Facebook, of course, to talk about the Johnson & Johnson vaccination pause. And this was a really successful and great way of doing this. They were able to, of course, try to get out in front of any questions or concerns that patients may have after hearing the news about the Johnson & Johnson vaccination being halted for usage. And they wanted to make sure that this was, of course, not affecting their patient population too much in terms of those that were already on the fence about receiving the vaccine in general. They, of course, didn't want this news to affect them in a negative way. So they tried to get out in front of it as quickly as possible and host a Facebook Live as really a Q&A session, and then more information on the vaccine. And then, of course, I'm sure everyone's asking, what about the actual coordination and delivery of the vaccine? So we've seen CareMessage being used to actually schedule the appointments and the visits. Mercy Clinic has a great example of this, actually working in conjunction with the CVS to schedule those appointments, being able to remind patients about their appointment, either first or second dose, via a cadence of appointment reminders that we offer, which are automated, usually about a week, 3 days, and then the day before the appointment. Personalized follow-up after the vaccine to check in on patients, see if they're feeling any side effects, just giving them a little bit of that touch point that maybe some of them are looking for as well. So we had a clinic in Oregon that was able to send a message basically just telling patients, I'll just read it verbatim: by scheduling a vaccine appointment with us, you are doing your part to keep our community safe. These vaccines are safe and effective at preventing serious COVID illness and death. They are also a powerful tool for ending the pandemic. Do you need help scheduling your vaccine visit now? Which they were able to, of course, get a multitude of responses from patients. And then lastly, we had a clinic in Ohio. This is one that I really love because it's such a powerful usage of our multiple choice messaging, where patients actually have the ability to simply text back an A, B, C, D response. And as many will probably imagine, we see an incredibly high response rate on average to these multiple choice questions, because really all it's asking of a patient is to send back a 1-letter response. And who doesn't love sending back a K message, or whatever it may be, making it so much easier. So what this was just asking their patient population, are you interested in the COVID vaccine? Please give us one of the following answers. And then patients had the opportunity to respond back: I already have received the vaccine. B, I don't want the vaccine. C, I'm still unsure about the vaccine. D, I'm interested and would like to schedule a vaccine appointment. And then, of course, you can simply filter those results. So all patients that texted back B in this example, we could text them on a 1-to-1 basis, asking for more information, or maybe linking a study from the CDC, or telling them 250 million people have already received this vaccine. Really, it depends on the health center and how involved they want to be, and how much they feel is on their own impetus to, of course, schedule and talk with these patients. So this is going to be the perfect time. I have been monologuing. I'm sure everyone's tired of my voice at this point in time. So I'm going to actually throw it over to Peggy now to talk more specifically about Mercy Clinic and their uses of CareMessage, and then as well as just Mercy Clinic in general. So Peggy, I will open the floor up to you now.
Thank you, Jameson. It's so good to share about Mercy Clinic, and I appreciate the opportunity. Mercy Clinic is a small medical dental clinic. We do primary care, medical care, and dental care for uninsured adults in Fort Worth, Texas. And we opened our doors in 2011 and began the process of seeing patients. And as Jameson said, I was approached, given information about CareMessage in 2014. And I thought that this would be a good platform for our community in order to get information to them. When you're dealing with people who are working intense jobs, labor-related jobs, their ability to answer the phone when you call them is not as, it's just, they're just not able to. So a text message gives them an opportunity to, when they are able to look at their phone and see communication, then it's available to them. And we used it from the beginning for appointment reminders, event invitations when we were having health fairs, or we're doing free mammograms this day. You just send out an email, a text message to all women over 40 who, and with all the parameters. So that was able to get us get us in contact with the people that then we could begin the scheduling process for the mammograms or flu vaccines, or whatever was the case. Medication refill reminders, prompts to encourage them about their exercise or diabetic needs, and all of these able to be customized and in English and in Spanish. So the majority of our patients are Spanish speakers. So the ability to craft a custom message and has improved our access to our patients and our ability to communicate. So it's just been a great patient engagement tool. And then certainly, as Jameson has said, in March 2020, the world changed so much about what was available to us and how to communicate with our patient population. Initially for us, because of being an all volunteer staff, Mercy Clinic had a situation where we would need to tell our patients that we weren't, able to be open, but this would be the other avenue that we could begin to help them with their medical needs. So that pivot to telehealth was quick because we were able to communicate right away with them, with our patient population, that our hours had changed, and to send out safety measures about washing your hands, covering your face when you cough, all of the CDC information. So that CareMessage linked us to our patients in a very vital way because we are a very small organization with just one person who is in charge of the communication with all of our patient population. So in June of 2020, Mercy Clinic was approached by CVS Health about being a COVID testing site. The operation was that CVS would bring their staff and the testing supplies. We would provide the space and the logistics related to scheduling patients, people who needed testing for their appointments. Well, immediately our phone system was totally overwhelmed with phone calls. And so how do you manage all of that while you're still trying to, remember, we still have a patient population that we are trying to minister to and take care of. And then we've opened up our doors to people from all over everywhere who came for rapid COVID testing. And so the problem solved for that was that we began to communicate even more heavily with our patient population through CareMessage, because this allowed us to handle the overwhelming number of phone calls we were getting for testing, as well as find the space in our lives to keep our patients connected to us for medication refills, to be able to speak with have a telehealth appointment. And then when we began to open again, how reminders for their patient appointments. So they allowed us to maintain, so CareMessage allowed us to maintain our communication with our patient population all during the pandemic, to schedule appointments or information, and for the testing as well. Just when you think about having one full-time employee who would be handling, the clinical aspect of all of this, that we have performed over 16,000 COVID tests at our site since June of 2020, as well as the 25,000 phone calls that went along with that. And the ability to use text messaging in this whole situation has been very helpful. Then when the vaccine became available to our patient population, then we were able to use the COVID-19 vaccine templates created by CareMessage to send out blanket text messages about, first, education about the vaccine, and then eventually into, would you like to get the vaccine, and be able to set up an appointment for that. That same format we've used for when we have health fairs and we have back to school immunizations, for flu vaccines. Now for the COVID vaccine, it has been a way for us to communicate completely with our patients. We've done several sets of small vaccine clinic pop-ups, and would have 100%. Each time we've basically had 100% participation, patients make an appointment, coming to their appointment to receive the vaccine. So definitely that communication through CareMessage has kept us to basically have a lifeline to our patient population. We've loved the analytics that CareMessage also gives us about the number of messages that we've sent. And this is just 1 month's set of data, that over 12,000 text messages were sent through CareMessage. And patients are just so much more likely to respond via text message than receiving a phone call from an unknown number, or they just, because of their work schedules, they just cannot answer the phone. And we that much communication, think about 11 messages sent per patient in March, so that there's just a back and forth communication and answering of questions and giving out of information that's been so helpful. And certainly the being able to send messages in English and Spanish has just been a lifesaver. We really couldn't do that, communicate well without that. We've done, we monthly have a vision screening time with a community partner. And the way all of those appointments are set up is through CareMessage text messaging. And the idea of being able to refill prescriptions, all of that is done with the help of CareMessage as well. Some of your prescription's ready, it's time for you to come pick it up. All of those kinds of things are able to be communicated by text message. So we have found CareMessage, after 7 years of use, to be a vital communication tool for our patient population. We're collaborating with CVS to provide free COVID vaccines for people over 16 years of age. And so all of that still has also been coordinated through our CareMessage text messaging. As I mentioned, the virtual vision screening with Prevent Blindness Texas, just a very quick text message goes out like, this is the date we'll be having it. Would you like to be, be included in this registration, and then our patient population signs up in that way, and in Spanish and in English. We are at this point expanding to a new area, even beyond our current patient population, and expect to be enrolling more and more new patients in our database. And I can see how being able to use the text messaging, just first you say to a person at an interest meeting, give us your phone number and we'll begin to, you can begin to ask questions via text message. We can let you know about any any healthcare event we might be having in the future. And just another way to have communication as we expand our database and the number of patients that we see. Oh, I think that's
awesome.
a vital tool for us. I can imagine. And and I should just mention too, that what is so wonderful about CareMessage is how easy it is to use. And we have basically an all volunteer staff. You have a local university student who comes into work a shift, and their assignment is to schedule all the reminders for patient appointments, or set up text, broad text messages to for groups of people. And it's very easy to instruct someone in being able to just to do that. So we found that very helpful. It has multiplied our staff hours immensely. We just really couldn't have done it without this communication tool. So I'll give it back to you, Jameson, if you have any other thoughts.
Yeah, thanks so much for that, Peggy. And we're lucky to have such great partners, of course, like Mercy Clinic, that is doing such great work. And 25,000 phone calls, just the thought of that sends shivers down my spine. I can barely answer, a couple within a day. So just incredible what you all have been able to do. And then obviously the 16,000 vaccinations that are a direct result of Mercy Clinic. It's really incredible what you all have been able to do. So we are so lucky that you agreed to do a webinar with us, and thanks so much for doing so. So I guess we will be wrapping it up in just a couple more slides. We'll have a Q&A section after this, but one of the main questions may be, how do I join the CareMessage family? What do we do? So we will be sending, once again, this information via email post this webinar. But if you would like to get started on our free CareMessage Lite program, what can be done is you can visit caremessage.org, obviously our website, and you can sign up and begin onboarding directly via the website. And that's a free program till at least the end of 2021, this calendar year. That has our outreach and our messaging functions. So our one-to-many messenger, as well as our one-to-one messenger. It's really just doesn't allow appointment reminders is the big proponent or component missing, just because we've seen that requires usually a pretty large onboarding time and some training and some things that our full platform includes. And then we'll also send the bit.ly links to the message library that we've been talking about with the crowdsourced and free COVID messages. So even for those that are already using a different text messaging platform, if you'd like to take advantage of those, you can easily do so via this crowdsourced information that we have. And then we have some video on telehealth as well, some tutorials, some best use cases. Obviously doxy.me is a big one, Zoom, whatever you all may be using. So we will throw it over to Q&A now. Please feel free if there's any questions for myself, and then I'll speak on behalf of Peggy and Ariana as well. If there's any questions for them, please use the question and answer or the chat function now. And if there's any questions that you would rather have answered, personally and don't want to open up to the crowd, please feel free to contact me at my email here, which is simply, jbecker@caremessage.org. So first letter, first name, J, last name, Becker @caremessage.org. So let's see, we've got a couple questions now. So one question will be, we have had CareMessage for a few years and like it, but we've not mastered the ability to easily sort out criteria for certain populations. Where on the site can we learn more about that? Awesome. Yeah, no, most definitely. So that would be utilizing our grouping feature within CareMessage. And what you would do is on the CareMessage website, you would go to the bottom left corner where there's all the features. There will be a help section there. And what you can do is click on that, and then you will go to basically a forum that's going to have a bunch of different common support questions there. And what you'll want to do is either go to file upload or patient grouping. And what you can do with our grouping feature is when you're uploading, your CSV file or bringing your patients into the CareMessage system, you can actually have a column by groups. So for example, we see a lot of use cases where this could be your patients, grouped by chronic condition. So it could be all of your diabetic patients, all of your hypertensive patients. For those using CareMessage in conjunction with a pop health tool, we'll even see that on a more granular level where maybe it's all of your patients with a certain A1C above 9 or, your A1C at a certain level. We also love use cases around, social determinants of health. So we've seen a large use case recently where patients will send out, or the clinic will send out a quick impromptu survey saying, hey, COVID's been really tough on all of us. Do you relate to any of these issues that we're seeing largely in our patient population? And then patients can text back, A, I have rent insecurities. B, I have food insecurities. C, I have transportation issues. And then depending on those results, you can then once again use this grouping feature where if a patient has food insecurities, you can send them a monthly outreach about the most recent food drives or up and coming food banks, food drives, ways that they can procure and have the ability to get food. So hopefully that helped answer the question there. We have another question that this is a great product. Athena Health has this functionality built into their EMR. Is there a need for CareMessage's service if a member already has Athena Health? Really good question. Yeah, really, really good question. So Athena Health, just like most EMRs, were, built as an EMR, of course, and their main functionality is that of an EMR. So having your patient profile and patient data. And now what we've seen with Athena and ECW and NextGen and Epic and most of the big players out there is that they do have we'll call it an impromptu texting service where due to demand, they have started offering text messaging services, but their platforms were not specifically made for texting with patients. Whereas, CareMessage, we of course were built as a patient engagement platform. And I'll mention that we are built as a patient engagement platform specifically for underserved patient populations. So what that means is that just the ability to communicate with patients via a bidirectional text is so much greater through CareMessage than any EMR out there currently. You're able to, group patients, get very granular data. You're able to receive the results of each individual text message. You'll never be charged a per message cost or any sort of additional fees that most other carriers out there in EMRs, they'll charge a per text fee, as well as a lot of them have unidirectional texting rather than bi-directional, meaning that you can text the patient, but you're not able to gather responses back And of course, if there's any more specific questions about your current use cases or your current experience with the specific EMR, then please feel free to email me down below, and I would love to have a conversation more specifically so that we can dive a little bit deeper into the specific details there. And then we have another one saying, we have used CareMessage for many years. However, we still have the original opt-in set up for patients. They sign a consent form. How can we switch over to an opt-out so we can get all of our patients in at once unless they opt out? We would really like to do this for the vaccine outreach and education. Great question. I will actually move over to our last slide. These are an FAQ of our most commonly asked questions, one of which is the perfect segue. Do I need permission from my patients to text them? So we at CareMessage, I would say about 99% of our clinics actually work currently as an opt-out method rather than an opt-in. And what that looks like is when you get started on CareMessage, the very first thing that will be done is sending a quote unquote welcome message. And this will be something along the lines of, hey, this is XYZ Clinic. We are texting you from this new number. And this is a means of communication that we plan to be using moving forward. If this is something that you are uncomfortable with, please text us back now saying stop or opt out, unsubscribe, no, really any word that could possibly mean I do not want this. And then that patient or those patients will automatically be opted out of any future text messaging conversation, of course, unless they explicitly, either in person or via phone call, tell us at a later date that they want to receive these messages. You can manually override that and then re-enroll them. But unless that specific scenario happens, they will never receive texts via CareMessage. And then moving forward, any patient that receives any sort of text message moving forward, they will always have the ability to text stop or opt out. Once again, words along those lines, and our system will automatically opt them out of future text correspondence if they text back to any message with any of those key trigger words. So we actually work most primarily as an opt-out approach, just because we found that if a patient is, supplying you their phone number in clinic with their patient profile, they are mostly consenting to receive communications from you to that number, either via voice or text. So we want to give them the opportunity to opt out, but we're going to explicitly think that they have opted in up until we hear that. Let's see, it looks like we have another question. Follow-up question. How do we originally get all of the patients into the CareMessage system? Is this a function handled in the onboarding process? Could an existing clinic still work with someone to do this? Great question. So how do you get patients into CareMessage? That is a pretty important question, and one that we should definitely go over. So what you will do is in most cases, you will have a CSV, separated value Excel file. So that will look like pretty much any other Excel you've seen. It will have different columns and rows. Examples of these columns would be patient unique identification number, MRN, patient first name, patient last name, patient date of birth, patient primary language, patient phone number. You get the idea, those columns. And then usually that will be super easy to just export from an EMR, whether that be Athena Health or ECW or any of the aforementioned EMRs. They'll have a patient data or a patient column where you can just export that directly to a CSV, and then you'll just take that CSV file and upload it directly into the CareMessage system. And in terms of getting help on that, we have both customer success as well as support teams available. So when you get started on CareMessage and onboarded, we will, of course, give you some guides and walkthrough information of how to do so. But if you ever have further questions or would like further help, that's super easy to do. I lead our free clinic partnership, so I'm always available to help walk through. Otherwise, what we do is we have a sign-up sheet with our support team where if you have specific questions that are maybe more than just asking via email or chat functionality, you can schedule time with our support for a 30-minute Zoom call or whatever it may be, and then they'll actually be able to share screen with you, walk you through any questions that you may have, and just really be able to help you to the extent that you of course need help with CareMessage, whether that be to upload patients, or we even see examples of, hey, we're trying to do COVID outreach, we have not seen a good response rate up to this point. Do you have any best practices or tips or tricks that other clinics have used? And being able to have that conversation with our support team as well. So awesome. Well, for the time being, looks like those are the questions. Maybe some were asked in chat here. Let's see. Okay, sorry. It looks like I was taking up a lot of the time here. So Peggy, if you're still on, there actually is a question for you. Peggy, would you mind answering one question that I can read off to you?
I would say 2 or 3 hours. I mean, at all. I mean, it could be one evening with a volunteer who works a shift and does it. So that really doesn't take any time. And we do the uploading, like it's not linked to our EMR, but we use Practice Fusion. But we enroll the patient in CareMessage simultaneously with when they are enrolled as a patient through our EMR.
Awesome. Thanks so much. Yeah, great. And most of what we hear, obviously everyone varies of how they use CareMessage. Most aren't spending too much time on CareMessage. I will say that a lot of clinics that we work with, most clinics have CareMessage, since we are a web-based software, running in the background at pretty much all times throughout the day, just so that if there's any direct messenger texts that come from patients, they can answer those in a quick and meaningful fashion. But it should not be something that you're spending all day, every day, monitoring and using CareMessage specifically. It's obviously to supplement your in-clinic activities. If there's any other questions while we wait, if there are, just a few other FAQs to answer. So a big question is CareMessage HIPAA compliant? And if so, how so? Of course, a top of mind question for almost everyone, to which we answer, CareMessage is fully HIPAA compliant. Before any health center starts with CareMessage, not only will they sign a BAA, but also an MSA to get started, which outlines our encryption, our compliance, really anything that you can imagine in those very fun and long documents. But we use Google Cloud specifically to host our platform, and we've also signed a BAA specifically with Google Cloud outlining all possibilities, and Google Cloud itself has HIPAA compliant protocols in which we follow, and they of course follow as well. So our platform is 100% HIPAA compliant. We're partnered with the NAFC, as was obviously mentioned at the very beginning of this call, and of course, in order to be so, we have to make sure that all of our I's are dotted, our T's are crossed in terms of HIPAA compliance. And then just last question here that is a common one is, can I send links, through CareMessage? To which the answer very much is yes. Of course, in pretty much all cases, we would hope that patient portals were used more commonly. We of course always see that adoption rate, usually around 20 to maybe 25% of patients actually using a patient portal. But a great usage of CareMessage is actually sending patients their patient portal via a text message saying, hey, here's your test results. If you'd like to see them, please follow your link here so that you can log into your patient portal. Or you could send something like a SurveyMonkey or Survey Gizmo URL post-patient visit, or quarterly, annually, to get patient responses to how they've enjoyed their visits, what could be done to improve their experience. You have no confines in terms of what you're able to send as a URL through CareMessage. Lastly, what languages does CareMessage support? So we officially support English and Spanish, meaning that any message made in English can be translated to Spanish and vice versa. We have a dedicated Spanish speaker who does these translations in-house. So we're making sure that we don't use a Google Translate or otherwise, just because that can lead to a whole host of issues with cultural irrelevance for messaging not coming out how it's supposed to. But we also, CareMessage, once again, has no confines in terms of what can be sent. So we see, messages being sent in Mandarin or Russian or, other characters outside of what we're familiar with. And that can be sent 100% through CareMessage. We would just ask that if you're planning to use a message in or send a message in a language outside of English or Spanish, to maybe consult with us first, get some best practices and workflows on how to do so. Just because if you're trying to send a message that's a yes or a no that has an automated response, our system will only recommend or understand answers back in English or Spanish. So we can work with you on the characteristics and how to make sure to effectively send messages in other languages. So that looks like we have no other questions, and we are about right on time here, about 3 minutes to spare to the hour. So just want to say a huge thanks to Ariana, who I know jumped off the call, but I'm sure if there's any questions for her specifically, I'm sure most on this call have spoken with Ariana before, but you'll be able to reach her. And once again, super big thanks to Peggy for joining us here. Really, really happy with what Mercy Clinic's done. And I'm sure this partnership will last many, many, many years to come between Mercy Clinic and CareMessage. So thanks so much for everyone for joining. We will send a follow-up email outlining this and sending the recording for anybody who wants to share that internally within their organization. And, my email, once again, is jbecker@caremessage.org. So please feel free to answer me. Please feel free to email me with any questions that I can answer. And I look forward to, let's check this chat one last time. Thanks all for joining us, and I'm hoping that we'll all be in contact soon. So thanks so much, everybody. Bye-bye.